I asked Jeff to do this section because who better to talk about lactation than someone that has a background in dairy cattle? Jeff's academic background, and I think his growing up, he was very involved with dairy cattle, still is, but now he's like a lot of county extension agents. His knowledge just goes across many commodities, many different species. Jeff works very closely with me on just about every small ruminant program that we do, in particular the meat goat performance test that we do. He's basically a full partner in that, and so I thought Jeff would be great to do tonight's presentation. I'm going to ask that questions in this first hour be limited to lactation, and then when that presentation is over, feel free to ask any questions, make any comment, you know, different things. I'm going to kind of lurk in the background and try to answer some of the questions in the chat box. And so with that, I'll introduce Jeff Semler. He's the county extension agent here in Washington County, which is the county where our research center is located.
All right. You can let me know if I talk too loud, because I don't want to do that. I don't want to be eating my microphone. I'm used to teaching live and used to moving around, so I'm going to have to sit still, so I'll do my best. We're talking about lactation tonight, and of course it begins with the birth of offspring in mammals. I tell everyone that they're dairy farmers, regardless of whether or not they sell milk in a big silver truck. You're either selling milk in a big silver truck, or you're selling milk, in this case, in the form of lambs or kids. It's a very demanding time in the period in the female's production cycle, and we'll deal with that in more depth as we go. What happens, or what's happening, it's a huge metabolic change. Not only is it exciting for the shepherd or the goat owner, but it is a time when a lot of things starts happening. The udder's secreting milk. The rumen capacity is now increasing because we got those bloody kids out of the way, and we're also going to be in a negative energy balance. Extra nutrition is needed. Pregnancy toxemia, ketosis, and milk fever can still happen after the birth of the kids or lambs. Don't think that only happens during late pregnancy. It can also happen during lactation. We need to look at extra nutrition based on milk production, or supporting milk production, I should say, and that's going to vary whether you're milking or whether the lambs or kids are doing the milking. It's going to be dependent, or going to be variable based on the number of births, and we need to have good milk production to ensure the growth of strong and healthy babies. And we'll talk about each of these things a little bit more. During lactation, energy is the nutrient that's most likely to be deficient in the diet, especially for those that are grazing. We rarely have problems with protein when you're on grass, but oftentimes energy will be deficient. Now that certainly will be dependent on the quality of forage you have out there and other things. Ryegrass tends to be higher in structural carbohydrates, but in general, at least especially in our climate, we tend to have plenty of protein in our grass and not as much energy. The nutrient requirements vary by species, by age, by size, and in some cases by breed and the number of young. Good friends of Susan and I, he still raises some Southdowns. He raised them as a 4-H'er, and he'll tell you that a Southdown can get fat on a dirt road. So you've got to be careful. If you know your breed is susceptible to getting too fat, you need to keep that in mind as well. To meet energy needs, you usually need to feed some grain. You've probably started to feed some grain in late lactation, so increase the grain slowly and incrementally. Do not just start pouring the grain to them. That rumen is delicate enough, and after we've just went through parturition, it's going to be even more delicate. So you need to really be careful not to get too excited when it comes to graining. And if forage quality is low, if you're feeding less than exceptional hay, you're going to need to supplement some protein and calcium as well. Yes, that is, I believe that is straight corn in the feeder, and you can indeed feed corn at $7 a bushel. I'm not sure you want to feed it, but you can feed corn or barley, whatever grain starch of your choice. I certainly would say watch your feed costs. As far as loss feeding whole corn, I'm assuming you're meaning loss in the fact that they're pushing it out of the feeder on the floor. Are you talking about whole corn coming through the rumen, like some people are used to seeing in cattle manure? Okay. Sheep do utilize whole corn more efficiently than processed grains, and they do it a better job than, actually small ruminants in general do a better job than cattle do. If that's what you're thinking, you see. The other thing you need to remember when you see it in the manure of cattle, there's been a lot of starch that's been digested across the cell wall of the corn grain as well. So it's not 100% wasted like people like to believe. So what should you do? Balance a ration to determine what and how much to feed. Evaluate your ration to see if what you are feeding is meeting the nutrient requirements of your lactating females, and adjust if necessary. It's good to know that most people in the small ruminant business haven't supplanted technology for husbandry. Look at your sheep, look at your goats, and they'll tell you what you need to do. What do we usually do? A lot of people, depending on their markets, will try to lamb or kid with pasture growth. In our country here, we start somewhere in the middle of March and move on. For other places, it will be later or earlier, or if you're trying to hit a specific market, for instance, Easter, you're going to be lambing probably or kidding in December, and then you're going to feed free choice hay and some grain. All right, nutrition during lactation. Again, lactation is a very demanding period for ewes and for does. I tried to use the word female, but this is actually the composition of ewe milk, so I didn't want to use female here. And if you look at it, it's quite nutrient dense, and so the point here is you need to feed that ewe just like an athlete, or that doe just like an athlete. So you need to make sure that she's a performer, she's producing a high quality product, and you need to treat her as such. If ewes are to milk well, they need a high quality feed, as I said, and they need unlimited access to water. Nutrition during lactation. Females that are suckling more than one offspring will produce more milk because of the nursing stimuli. Here you can see that this particular ewe is, shall we say, a multi-use animal. She's nursing as well as being milked at the same time. So I don't know if you would feed her like she was nursing twins or not, but nonetheless. Females with twins or more, I saw there's a fin sheep person on here, so I can tell you for sure that that they have more than one. Judy, you had your hand up. You need to type your question in, please. And I'm thinking that you're probably correct. It probably is a carrot call. If at all possible, you should separate. Again, this is if you're nursing and not milking. You need to separate, if you can, separate your ewes that are nursing more than one, or group them according to the number of young they're nursing. That way you can feed them accordingly. If they're out on pasture, it's less likely to be necessary, but certainly if they're in a dry lot situation, it would be much easier because, as you well know, the queens of the feed bunk will get what they want and everybody else will get what they get. Body conditions very important when lactation during lactation. Feeds need to be considered. You need to know what body condition scoring is. You need to look at them. It's even more important for those that are going to be milking, either regardless of their goats or sheep. This is one of the indicators that will help you know how your feeding program is going. Usually during lactation, the female's in a negative energy balance. The amount of demand you put on the ewe, whether it's with another baby or whether it's with milkers, is going to increase that negative energy balance. She simply can't eat enough to satisfy her energy requirements with a forage-based diet. So you either have to do one of two things. You either have to back down the energy demand or you have to increase the energy fed. I would choose the latter. It's normal for her to lose weight during lactation. Don't get excited about that, but you don't want them to become extremely emaciated. In fact, fat females at weaning time should be eyed very suspiciously. Judy, there are some programs out there to balance rations. I'm sure they'll be on the resources on the site when Susan gets them up. We talked about those a couple times. Langston has one for goats, and I believe it's Montana State for sheep. And and Susan says there's a new book out there as well. Back to fat females, you basically should run your operation that you're not running a welfare camp. So look over those fat females and see what's going on. While most of the time you can gauge the milk production of your ewes or does based on kid or lamb weights, you also have to remember that there are a lot of kids and lambs out there that get good at stealing milk, and there are some ewes or does out there that will let anything and all nurse on them. So you can sometimes be fooled by weaning weights. The key is not to allow her to lose so much weight that she can't regain it during the maintenance period. And this is very important when it comes to breeding those ewes or does back. You want to make sure that she doesn't get so far behind that she can't make it up before you're ready to breed her back. Here's rules of thumb, and these are just rules of thumb, but you're looking at that's the percent body weight of dry matter intake. I use percent body weight because of the fact that putting pounds down there means that then I have to make up slides for all different weights and scenarios, so I took the easy way out. The TDN is what we look at as energy. It's 65%. You see that's consistent, but you'll see that you need more crude protein when you're nursing more than one lamb or kid. Calcium and phosphorus goes up because milk production goes up, and there's calcium and phosphorus in milk, and you can only metabolize so much of that from her reserves. Water. I want to speak on water, and I want to emphasize water because of the fact that it's often the most forgotten nutrient. Lactating females require a lot of water if they're expected to milk well. If you remember back a few slides ago, we were talking about ewe's milk being 85 or 83% water. That's water above what her body needs. So you need to remember that. It's estimated that lactating females require 100% more water than they did just prior to them giving birth. So when they were dry, and again, that's going to increase through the dry period, but when they're dry, they don't require nearly as much water. When you say the previous slide, do you mean this one?
No, I actually provided the URL after that.
Oh, I'm sorry. Okay. Water should be free choice. It should be clean at all times. My recommendation is if you wouldn't drink out of the bowl, neither should they. Heated water bowls are recommended in the winter, and that can be active or passive heating. It doesn't have to be, electric. Those electric fonts, you can use geothermal. Here we bore a hole down in the ground about 6 feet. We use a 6-inch or larger diameter pipe that goes down in the ground and utilizes the heat of the earth to keep the water from freezing. In extreme cold and wind, depending on where your water is located, you still may have the freezing going on. Ice is not water. It's a state of water. So don't be fooled into thinking, well, they'll just lick that icicle. And the other thing, don't be fooled, especially if you're been wintering your ewes outside or your does outside and they come in to lamb and to milk or lactate, they still if they still have access outside, they're not going to be able to eat enough snow either. So make sure you've got water. Water bowls should be checked and cleaned as needed, but they should be checked every day, cleaned as needed. Oh, my apologies to the dairy goat folks. There's supposed to be a beautiful dairy goat right there in that picture. Just imagine that if you would. The average dairy goat has a 10-month lactation and produces 6 to 8 pounds of milk per day during that lactation. That's the AGDA's estimate. I know we have a person here in Washington County who would just be mortified if I said that's how much milk a dairy goat gives, because they would tell you that their Sawnens do a much, much better job than that. These averages, of course, vary from breed to breed and from goat to goat. Dairy sheep. And I don't know how many of you out there milk your animals, or I'm assuming there may be a few. I know that certainly some of you rely on your lambs or your kids to do the milking. While you can milk any breed of sheep that there is, they're just like other species of livestock. There are specialized dairy sheep breeds. You can milk an Angus cow if you want, but certainly a Holstein or Jersey will do you a better job. Worldwide, there's more than a dozen dairy sheep breeds, but only a few are here in the United States, and the ones that have been here, the East Frisian was probably the first to arrive, and the Lacone, a French breed, is here now as well. The specialized dairy breeds of sheep, you can see give between 400 and 1,100 pounds of milk per lactation, whereas the milk production of a conventional sheep breed may only be about 100 to 200 pounds per lactation. So that's a considerable difference. But again, if you're going to be milking sheep, you're going to want to get as much per lactation as you can. It's just one of those things that you ought to think about when you're selecting your breed. I do know that there's a person in Pennsylvania that milks Shropshires, and I believe she makes cheese, but I'm not sure how her Shropshires would stand up to an East Frisian. Meat animals, meat does and ewes, typically your lactation is going to be between 60 and 120 days. That's certainly your call. Some producers will allow the females to wean their own offspring. In other words, you just let them all out there, and that is a soy, by the way. You can allow the ewe will, or the doe will decide when she's had enough, and she will certainly wean her own offspring. And that is a management practice that's totally acceptable and one that some folks employ. You've heard this in a couple other of the talks. Proper feed bunk management. You really need to make sure that all the ewes and does can eat at the same time. For those of you that are milking, that's not really an issue because you can give the supplemental feeding as you're milking, so you can control some of the intake anyway that way. If they're on free choice hay and the grain they're getting is when they're being milked, then that's a perfectly good scenario. Feed ewe lambs and doelings separately from mature females if you can, and again, segregate and feed based on the number of offsprings if possible. You have to really look at it from that perspective if you're gang feeding, especially a first-time lammer or kidder may be much too timid to get up to belly up to the bunk, if you will, and and you all know which ones they are, but you have those boss does or boss ewes that are going to command the feed bunk, and they're going to push those timid animals away. The other thing, as far as segregating based on numbers of offspring, again, we're looking at the idea of feeding more energy to those that are under a higher demand if they're nursing twins or triplets or more. Don't feed on the ground. It says the exception is frozen ground, and that is certainly true for hay. I wouldn't ever feed on the ground grain, just because of the fact that you're encouraging, or if not encouraging, but you're certainly fostering the fact that they're probably going to be eating dirt as well. As I said, milk fever, and that's, Susan, that is your ewe. I got it off your website anyway. Just a different angle that we've seen this ewe from before, but milk fever is still an issue during lactation. Certainly, when we get that metabolic change, it doesn't necessarily mean that milk fever goes away. You can see the fancy name for milk fever there. Basically, it means low calcium. That's what hypocalcemia means. It's usually seen in high producers, and up to 3 weeks after kidding or lambing. As Susan already mentioned, my background and still a portion of my work is done with dairy, and we have seen even cows, Jersey cows, which are susceptible to milk fever, by the way, get milk fever in mid-lactation when the ration changed abruptly. So that's something that you should also keep your eye on. You can get milk fever, yes, before kidding or after. The calcium requirements virtually double during late pregnancy. Initially, these are symptoms, by the way. Initially, the doe is ataxic, nervous, hyperactive, but quickly becomes sternally recumbent. That's a fancy word for means she's laying down like that ewe is. She's laying on her chest. The doe or the ewe stops eating, and the ears become cold. Milk fever can usually be treated with an intravenous or subcutaneous injection of a calcium solution. The response is it should be dramatic. The animal usually starts to shiver, brightens up by the time the treatment is finished. If she does not, it may be that the diagnosis is incorrect or complicated by another disease. We talked about that earlier, and in some cases, especially if you're given an IV, you need to be very careful about how quickly that happens, because you can indeed facilitate a heart attack if you give calcium too quickly. So you need to make sure that you do that in a very controlled manner. Some of the other metabolic problems can be, we're going to talk about mastitis in a little bit, and of course you also know ketosis or acidosis can be issues as well. This would be a great time to feed your legume hay if you've got it during lactation. Alfalfa, some of the clover hays, any kind of legume hay you have is great to go ahead and feed during lactation. And if you've got alfalfa hay, that's exactly when I'd save it for feeding to my lactating ewes or does. Grains that you're feeding are going to be low in calcium. Corn, barley, oats, soybean, triticale, any of those grains are going to be low in calcium, and so, but they're going to be high. They're going to be a high portion of your dry matter intake, because basically we think you need to be very careful with that, because if you're feeding a poor quality hay and you're feeding a lot of grain, your calcium can really get imbalanced. You can see there the question was about oral supplementation. You can see I have a drench there to the side. You can see that in addition to calcium, there's some magnesium and some vitamins, and also propylene glycol in that, so you're giving them some energy as well. Forages are high in calcium. Not all forages are high in calcium, but legumes are high in calcium. It does pay to get your forage tested if you think calcium is going to be a problem for you. So supplemental calcium supplement calcium with in complete grain mixes. So if you buy a complete grain mix, it's going to have vitamins and minerals in it. If you want to supplement through minerals, this is going to be dical or dicalcium phosphate, limestone, and the bone meal is primarily going to be from poultry. As you know, at least in the United States, ruminant bone meal cannot be fed to ruminants. So the bone meal there is not going to be ruminant bone meal. Mastitis, that's the number one issue in lactation. Primarily, it's a bigger issue, I should say, not primarily, but it's a bigger issue with those that are in the milk production aspect where you're actually mechanically milking or hand milking, but it's not to say that mastitis can't happen when your lambs or kids are doing their work. You also have, if you're going to, we're going to get to it, but Susan mentioned about early weaning. That's also a time when the heavy flow of milk, and all of a sudden the milkers get laid off. In other words, you've weaned the lambs or the kids, and she's still in high production. Of course, the word is from the Greek, and it means basically mammary inflammation, or mastos, of course, is breast in Greek, and then itis is an inflammation, and that's where you get tendinitis and all the other itises. It's an inflammation. It's especially the subclinical form can be a significant problem in sheep, goats that are managed intensively for meat and especially for milk production. And we'll talk about what I mean by subclinical in a minute, but that is a huge issue in the dairy industry at large. And when I say dairy industry, I primarily mean cattle, but a lot of the world drinks goat's milk and sheep's milk a lot more than they drink cow's milk. But here in the United States, we get we kind of get a little arrogant and we think everybody drinks cow's milk. Susan's question was, can male mammals get mastitis? Male mammals can get inflammation of the mammary gland, but it's typically not the same as mastitis from lactating females. So technically they can get an infected mammary, but no, it's not the same, even though it may be caused by some of the similar organisms. Subclinical mastitis, as the name implies, is less obvious. It may only be detectable by measures of the milk cellular content, in other words, the somatic cell count, as we call it in the dairy industry. The gentleman there is using what's called a CMT paddle. That stands for California Mastitis Test. You strip, obviously it was made for cows. You'll see there's 4 holes there, or I guess vessels there, and you only need 2 for a goat. You strip some milk into the receptacles, and then you put a reagent in it, and you get basically the milk clots if there's a lot of somatic cells in there. So you know you've got and somatic cells are basically white blood cells. If you want to think about it, they're in there trying to fight an infection, and so you get the it actually almost looks a little like mucus when you put the reagent in there and you tilt it, and it kind of looks, basically it looks like snot. Subclinical mastitis, again, this form of the disease is important for the following reasons. And this is, again, primarily focused at milk production, not the kids that are doing the work, but the fact that you're milking the doe or you're milking the ewe. You can see the prevalence. It's 15 to 40 times more prevalent than clinical. It usually precedes the clinical form, but not always. It is long in duration. It's difficult to detect, and it reduces milk production. I'm not sure what the figure is in ruminant milk production. I mean, small ruminant milk production, but in the cattle business, the dairy farmers, they're probably losing about 15% of production nationwide to subclinical mastitis. And it also adversely affects milk quality because of the high somatic cell count in the milk. Clinical mastitis this is the mastitis you see. If you're milking, you are looking at the milk all the time. You're seeing the clots, you're seeing the flakes in the milk, and that is what we call clinical mastitis. You can observe the abnormalities in the milk. You can see them in the udders as well. You can see if you remember back a few slides, the swollen udder. That is typical of a mastitic udder. You'll get inflammation, and you'll get the flakes and sometimes clots in the milk. It certainly will vary greatly in severity during the course of the disease. Clinical cases can be defined as subacute, that's mild, when symptoms include only minor alterations in the milk. The portion of the udder, just a small amount of clotting or flaking, discoloration. Sometimes you'll see blood. It's one of the reasons why I can't drink strawberry milk. It reminds me of bloody milk. But there are abnormalities in there, and the udder may also be slightly swollen and tender and even warm to the touch. Susan mentions OPP. It can also cause mastitis, and it affects both sides of the udder. Typically, in a mastitis case, you've only got one side of the udder that's affected. Not that it's impossible to have both sides, but again, typically it's usually one. Acute mastitis is just what it sounds like. These cases are characterized by sudden onset. There's pain, there's heat, there's swelling, there's redness, and there's adulterated or altered milk and from the affected halves of the udder. Abnormal secretion in forms of clots, flakes, watery milk is the clinical sign most consistently observed. If you see watery milk, probably have coliform mastitis, and we'll get into the different types of mastitis organisms a little bit later. But if you've got coliform, you've probably got some big trouble. Depending on the severity and causative agent, acute mastitis cases may have significant systemic involvement characterized by fever, depression and appetite, and weakness. And sometimes these, in addition to intermammary treatment, you also have to go with a systemic route, an injectable or subcutaneous treatment with an antibiotic as well. In its most severe form, it can be fatal, and such cases, of course, call for immediate attention. The bad news is, as we've talked over time, is that there's not a great number of small ruminant veterinarians, at least in Maryland. But the good news is, at least in our area, there are a great number of dairy veterinarians. So while they may not come out, they can certainly consult. These are the common mastitis pathogens. Staphylococcus aureus is the major one. It is actually, the answer to that question is yes. The other question you have to ask yourself is how soon. You need to remember that you have withdrawal times from antibiotics, and that transfers through the milk and to the lamb, so you need to be careful as to when those lambs are going to be sent to slaughter. So and that would be the case with any nursing animal. Some of that antibiotic is passed into the milk, and it will indeed transfer into the young, the offspring, and so you got to be careful as far as antibiotic residue in the meat. There are streptococcus pathogens out there. If you ever hear a dairy farmer talk about strep ag, that's the first one there. The other two are less common, but nonetheless are out there in the udders. Pasteurella is isolated, has also been isolated, and typically that is the nursing disease, if you will. That tends to be more common in animals that nurse. Not that I'm not saying that folks that are milking can't get that, but it does seem to transfer from the young to the udder. The next one's often, and I'm not saying it because I'll butcher the name, but it is indeed a problem in some herds. And then additional organisms are coliforms, which I talked about, and mycoplasma. The last two are pretty serious and can indeed result in the need to cull those infected does or ewes. Sometimes with coliform infections, they come on so quickly and are so acute would be a good, nice word for them, that you don't even get the chance in some cases to cull. You end up having to deal with mortality. Treatment, one of the treatments, especially for the subclinical, is just increase your milking frequency. Get that typically it's not E. coli, Stephen and Annette. It's other coliforms. The E. coli that is more of a problem you're thinking, or I'm assuming you're thinking of in is the one that we see for humans, but the coliform in again for mastitis is not E. coli. Again, back to the treatment, increasing the milking frequency. When I used to be milk cows, that was one of the things we would start doing, especially on a severely mastitic quarter, is we would milk that cow often. Fortunately, we had a stanchion where we could put hay in front of her and water, and we would just milk her several times a day to try to flush out the system. It doesn't always work, but a lot of times it will help. Infuse the affected gland with a commercially prepared intramammary infusion product. You have to remember that a lot of these products are not going to be labeled for sheep or goats. So you're going to have to work with a veterinarian when you're using these products. As far as the systemic, again, there are times when you need to inject, especially a very serious acute flare-up. You may want to use injectable antibiotics, and again, read the label, treat according to the label, dosages according to the label. In some cases, anti-inflammatory agents or fluid therapy are required. Again, these are going to be severe cases. It's going to be intravenous fluid therapy. When they talk about fluid therapy, they're talking about primarily, probably a dextrose solution, anti-inflammatory agents. Some of them you've heard of, Banamine. Again, read the label, get a veterinarian involved, because just like I tell my pesticide classes, it's the same with antibiotics. The label is the law, and you need to make sure that you remember that you just can't go out there and start freewheeling when it comes to using antibiotics. And if you're milking, look at withdrawal times, because that's really going to be a consideration. If you're in a commercial milking situation, you probably ought to have what's called a Delvo test. In other words, you test the milk for antibiotic before you're going to use it for human consumption. If you're milking commercially and you're shipping your milk, you're already doing that. At least in the state of Maryland, if you got a grade A license, you're doing it, which I think have all the way to 2 or 3 in the state, but nonetheless, that's standard practice. It is something you need to watch if you're using grade B and making grade B products, because the antibiotic will change the way the antibiotic test for milk is called the Delvo test. back to antibiotic contaminated milk, it can change the way, especially if you're a cheesemaker, it can certainly change the way your cheese will turn into milk or not. I mean, your milk will turn into cheese or not. Weaning, as we said, at least early weaning especially, often takes place at the time when females are still producing a lot of milk. In this case, grain should be reduced. And again, I'm talking about ewes that are nursing, not so much, you can, again, manage the system when you're mechanically milking, and you can start reducing, and you can change the frequency of your milking and so on and so forth to bring them down off that lactation curve. I picked this picture in particular because if you look at that ewe and those two lambs that are nursing on her, my heavens, aren't they big lambs? And so with relation to their mother, so isn't it about time they stop mooching and start get out there on their own? For the last week or so, the question from Doug is, can you allow the kid to nurse when the doe has mastitis? I can tell you this. There's a couple things that may or may not happen. If the udder is inflamed to the point where it is sensitive to touch, the doe will certainly let the kid know that they're less than happy with the idea. They may allow them to nurse from the other side. They may also not. So you would certainly want to monitor the kid's performance in that case. Sometimes you will get kids that will nurse, and the doe will let them in that really, again, the concern there is more with if she's treated with antibiotic, is the kid getting antibiotic in the milk? And if so, then we need to make sure that you watch the withdrawal time from the animal that may indeed go to slaughter. So that wasn't a very short answer to your question, but I hope I answered it. For the last week or so prior to weaning, no grain should be fed to the ewes or the does. Just kind of cut them off. For the last several days before weaning, you can feed them low quality grass hay or straw. Get them all, especially if depending on how your production cycle is going. Don't put those ewes or does out there on lush pasture and expect them to really lose or really stop producing milk. That's just going to actually increase your problems. As far as managing the udder of a ewe whose lambs are stillborn, basically she should, you should just take and bring her plane of nutrition down, and she should, you can just dry her right off. You can indeed collect her colostrum and put it in the freezer in case you ever get into a situation where you need some sheep colostrum. And as Susan points out there, you should get rid of females that get mastitis. I am one of those people that I'm an extremely rigid culler. In my little mind, there is no such thing as a free lunch, and so I practice that in all phases of livestock. Now I realize that if you've got a very small flock or a very small herd, you can't be quite as ruthless as I am, or I like to be anyway. But you need to think about those decisions because we've been tracking it now in dairy cattle for a number of years that susceptibility to mastitis or resistance to mastitis, depending on your take, is heritable. Is it highly heritable? Not really. But but it certainly is heritable. The question was, how long would it take a ewe to dry off at 8 weeks post-lambing? I'm assuming, based on your name, you're raising fin sheep, and fins are pretty decent milkers. But it shouldn't take them but you should really start to see the udder start to shrink and you know what they call involute in a week and a half. Certainly, one of the temptations is to milk an animal. What we've found, at least in dairy cattle, is that if we are tempted to milk the animal, a lot of times we cause more harm than good. It's not necessary to move water from the ewes at weaning. As a matter of fact, so no milking after weaning. That is a good practice for sure. Milking, as a matter of fact, what happens is you've got a positive reinforcement there. As you relieve the pressure on the udder, you get a mechanism, a positive feedback to the brain that says produce more milk. And so you're not doing a very good job of encouraging that ewe's brain to say, hey, we should stop milking. It's not necessarily to remove water. As a matter of fact, it can be dangerous, especially in hot weather. It's not at all necessary. If you bring down the plane of nutrition, you'll bring down milk production without a problem. Don't turn your ewes or does out on pasture immediately after weaning again. Lush pasture, high plane of nutrition, you're going to confuse the life out of that digestive system in that ewe or doe, and they're getting all that good feed, and their body's just going to want to produce the milk, and we're just going to have a problem there. That is correct. You can milk after weaning for personal use. There's not a problem with that at all. As a matter of fact, that's quite common even with the family cows. A lot of times they will, dry the cow off or wean the calf, but continue to milk, and you can do that with your ewes or does as well. And again, depending on the breed, will depend on how long that lactation is going to persist. Some of your high-producing sheep and goats you can easily get a 9 to 10 month lactation out of them. Some of your other breeds are not going to persist that long. This is just a slide that you've seen before, and I only bring it up because if you lamb or kid in the cold weather, you need to remember that there's an increased need of energy when you get out of the thermodynamic or the thermoneutral range of the animal. So you need to feed a little extra energy because they're gonna keep themselves warm first, and then again, we're in a negative energy balance in lactation. You're also gonna just going back and repeating the parasite information that we talked about before. You do get a slug. It seems like when the time that ewes and does are more susceptible to parasites, and so you want to remember that. I am a huge fan of the FAMACHA system. I think it's really important that you look at that as opposed to just worming by the calendar. The question was, do dairy sheep need sheared? Most of the dairy sheep are very short-wooled, maybe even, I think, when I say that, I'm talking about the East Frisians. They actually are clean-bellied, and so but again, if you've got a lot of wool on there, you certainly need to get the wool off. I wouldn't even say crutching, I'd say shearing if you're going to milk them. And as Susan points out, dock too, if they've got a long tail, it's going to be certainly an issue when it comes to the potential soiling of the udder. Back to my stump speech for FAMACHA. Again, lots of people or I shouldn't say lots of people, there are people that like to worm based on the calendar, and I am a huge fan of the Fibonacci system because, as you well know, we are getting resistance to anthelmintics by internal parasites, and of course when we talk about internal parasites with sheep and goats, we primarily mean the barber pole worm. So it's just really important. And of course, protein in the ration during late gestation and lactation is also a good idea. Do's and don'ts, again, increase the energy intake, monitor the calcium intake, encourage exercise. Again, these animals are athletes, and when I say encourage exercise, I don't mean go out there and run your sheep or your goats. I just mean make sure they've got plenty of room to get out and walk around or get up and walk around. Shear crutch, again, this is if they're just nursing. If you're milking, you need to shear them. Deworm and evaluate. Keep your facilities in good repair, especially if you're going to be milking. You're milking in a seasonal situation, so you need to make sure that system is up and ready to go before you have your first kid or your first lamb. You don't want to be fixing the milkers while your does are standing there waiting to be milked. Monitor for mastitis, and that's very important. And you need to remember to do that. You should forestrip your ewes or your does when you're milking so that you can look at the milk, observe it, and see if you've got any problems when it comes to mastitis. And then monitor body condition scoring. That's what BCS stands for. It's not Bowl Championship Series, which I loathe, but it means body condition scoring. So you're looking at what shapes my ewe or my does in, and monitor that. That's going to help you assess your feeding program. Am I getting enough energy? Is she milking really heavy and I need to increase that? And you'll be able to tell that by the amount of flesh that she's milking off her back. Don't introduce new animals at this time. It's an extremely stressful time as it is, and you don't need to add any more stress, which is my last point here. Don't mix pregnant ewes and lambs, or ewe lambs and doelings with mature females, and we've talked about that as well. Don't mix lactating females with dry females. Again, these are optimums. I understand if you've got 3 ewes, you don't want to move one ewe away from the other 2 when she lambs. But you can get, especially with young mothers, if you've got a young mother mixed in with some old mothers, you get some people that like to steal lambs or steal kids. And then you got a ewe or a doe that now is confused all to heck because she doesn't know if what she's supposed to do. She was a little confused before she had this baby, and now she's really confused because somebody else says it's not yours, it's mine. So that's the reasoning there. Overfeeding and underfeeding. Overfeeding is probably not going to be a huge problem until you get to weaning time or drying off time, unless you've got some lazy females or some females that are not producing. And then you want to be careful that you're not overfeeding, and you probably want to get rid of those slackers. Underfeeding, again, if you are certainly feeding for milk production based on I'm selling kids or lambs, underfeeding is going to cheat you and may indeed result in light lambs or light kids as well as unthrifty kids. Yes, you can get some compensatory gain post-weaning, but you certainly want to do the best job you can, because when the ewe or the doe is milking, that's the best feed stuff that young animal can get, especially based on its rumen development, and it's also the cheapest it's going to get. And the last thing is stress. Imagine yourself going to work every day and someone coming in and beating around and thumping around and yelling and hollering. Well, that's exactly what it sounds like to a ewe or to a doe when you come into the barn and she's nursing or you're milking or whatever. So just think about that. If my memory serves me correctly, Susan shared on one of our email lists I guess it was shortly before Christmas, about does in, I believe it was in England that responded to certain types of music, and I think it was classical music that they milked the best upon hearing, but I'm not 100% sure about that. Of course, plenty of country music fans will tell you that, oh, it was Mariah Carey. She's definitely classic.